Hello there. My name is Megan Clanahan. I am the co-owner of Houston Moms. And every month we bring you these informational health series videos from our preferred provider, UTMB Health, in Galveston, Bay Area, Clear Lake, that whole area. This month, obviously, as many of you know, is breast cancer awareness. So it made sense for us to not only bring in an expert on breast cancer, but also a patient. So this is a very special video. I hope y'all will watch, hear our patient's story and her testimony and how she has gotten through breast cancer and share it with somebody who needs to know as well. So let's get started. I have Dr. Silva with us to my left, probably. And then we have Tammi Moran, who is also a mom and a mom of 6, right, Tammi?
Yes, yes.
How old are your children?
My oldest just turned 19 and my youngest just turned 12.
Whoa, okay. So you had some exciting years there for a little bit. And Dr. Silva, you are the Director of Breast Cancer Services at UTMB Health. Is that correct?
That is correct.
Okay. Thank you so much for joining us. I know you're going to have a lot of input as we continue through this video, but we're going to start with Tammi. Tammi, tell us about your breast cancer journey.
Well, when I was 28 years old, I found a lump in my breast. I had previously had a similar experience when I was younger, and it turned out to just be fibrocystic changes. So for a while, I didn't really think anything of it. I had kind of gotten caught up in this rhythm of life with the kids where I kind of was neglecting my own health care at that time. But at some point I started to have other symptoms. I started to have bloody discharge from my nipples and some things like that. So I knew it was important to get in. And so I was able to get in to see Dr. Silva, and she really just did a lot of testing. And at the end of that said, I really just think we need to explore this more. So we did an excisional biopsy where she removed the milk ducts, and it came back that I had DCIS, so ductal carcinoma in situ. So that was a shocking development for me, but thankfully I had a lot of experts at UTMB that were able to just walk me through the process.
Goodness, and you were how old when that happened?
I was 29 when that happened.
29. So Dr. Silva, Tammi came in to see you. Kind of explain a little bit about her journey and why you guys took the course of action medically that you did for her.
Well, Tammi may be planning to expand on this further, but she's a super strong family history of breast cancer and ovarian cancer on both sides of her family. So that alone had already put her into what we would consider a higher risk group. And some of those women were younger when they got their breast cancer. I believe someone was 36. Is that right, Tammi? So they were on the younger end when that had happened to them. So we really felt like we needed to figure this out. And I think a key point here is that, first off, we're really going to focus on how important mammogram screening is, because it is critically important. But as a screening tool, it's not 100%. There are going to be certain things that are just not going to show up on a mammogram. And so if you're having symptoms, you should absolutely get a mammogram. You may end up getting an ultrasound or other studies, but if those can't answer the question of why you're having bloody nipple discharge, that still needs to be investigated. You shouldn't just say, oh, my mammogram was fine, I must be fine. So it needs to be checked out.
Okay, sage advice there. So Tammi, what was the rest of your journey like with the breast cancer? What did you ultimately end up having done?
Well, I knew initially that the closest people in my family who I knew had had cancer. But as I was referred to a genetic counselor, we ended up discovering, I contacted an aunt who talked to cousins and everybody and found out that the family history was a lot more extensive than what I was ever aware of. Especially in some of the older people in the family who had that when they were younger, they didn't talk about that. And so as this picture was painted, these are all the people, the recommendations kind of changed from, I think you can do just radiation and 5 years of tamoxifen therapy, to the genetic counselor and the medical oncologist recommending a double mastectomy, followed by a hysterectomy and my ovaries being removed. So I immediately had both breasts removed. I had a hysterectomy 6 months later with my fallopian tubes removed. I stalled on having my ovaries out because I was worried about the effects of early menopause. But there was some newer literature that said that just having your fallopian tubes removed would reduce that risk and kind of buy you some time till you got closer. My cutoff was, they said, absolutely by age 35, you have to have your ovaries out. And so I ended up having it done at 33. So there was a lot of follow-up in the meantime. Every 3 to 6 months, I had lab work and I had a pelvic scan to make sure that there wasn't anything kind of going on in the meantime between the time I had my hysterectomy with my fallopian tubes removed and then had my ovaries removed 3 years later.
Wow, what a journey. Where did you, with 6 kids at home and all of this information and uncovering family history that you maybe didn't know about or as extensive as it was, where did you find your strength?
In my faith, and also from my husband. He was very much from the very beginning, whatever we need to do it. If I need to take time off, if I need to mobilize people in our church family to do meal trains or whatever, you don't need to worry about anything except just taking the next step. And so that was very helpful, especially when it's something like having a double mastectomy. There's a lot of concerns that as a woman I had, and my husband just was like, no, we're moving past this. I just want to be old with you. Let's get through this. So that was really my family and my faith and my husband, for sure.
Yeah, and we attach, as women, we attach a lot to our breasts and without even, meaning to. And so that's wonderful that you had such a support system. Can you speak a little bit to UTMB support of your journey and how they communicated with you? And this was very extensive, and I'm sure a lot of emotions. So can you speak a little bit to that?
Yes, well, it was very jarring for me as someone who had really neglected my own healthcare, because I homeschooled. So I had 6 homeschooled kids and their own medical things. So to all of a sudden go to having multiple appointments, almost every week I had at least one in the beginning. It was scary, but the doctors were so calm. And so I was able to tell myself, this is like the worst thing I feel like has happened to me, but they see this every day. They know what's going on, and just the fact that all of my doctors were UTMB doctors. I had Dr. Silva on the breast care, surgical breast cancer side. I had Dr. Washington at the time was the medical oncologist. And then Dr. Richardson was phenomenal as my gynecological oncologist. And then Dr. Colleen Silva did all my scans every few months. And Dr. Robinson did the imaging, and everybody was just, the greatest comfort to me was that they all talked to each other. So there was never any contradictory messages that I got from anybody. They would say, I talked to Dr. Silva yesterday, this is what we're going to do, or, things like that. So I knew everyone was on the same page. All I had to do was show up. They were going to, and the fact that I had a lot of questions and a lot of concerns, and they never made me feel as if I was putting them out or inconveniencing them. They just gave me the time that I needed to make sure that I was making the right decisions. They answered the same questions over and over. And if I brought something in, hey, what about this? I read this. They would read over it with me and explain why they agreed or disagreed. So that was just very comforting, very comforting.
Did you ever think you'd have so many doctors and names attached to you where those almost become your family in a way during that time? Dr. Silva, with Tammi's journey, can you talk a little bit about how important this communication processes between all of the experts in each different field, plus your primary care physician.
Oh, absolutely. And it really is so important to be communicating among your group of physicians. And we're very lucky with UTMB because our electronic medical record, which is called EPIC, allows us to all communicate with each other, immediately. So as soon as I write a note, that's immediately accessible to all of our other doctors. I can also in-basket message them, with questions and concerns. So communication was really key. We also have navigators with our breast center that also help making sure that all the T's get crossed and the I's get dotted. So, we have a nurse and a medical assistant that are just a crucial part of the team as well. So it's really key. It's really key because breast cancer is multidisciplinary. It's very, very rare that surgery alone is going to be the answer to a breast cancer problem. It almost always requires a group of physicians.
And so let's talk about primary care physicians and how important it is for us as women, especially if we have a strong family history. What are the recommendations? How should we be talking to our primary care physicians about breast health? Like, what do we need to know?
Well, and that's a great question because, in the last few years, you've probably been aware there's some controversy about when should women start mammograms? Should they start them at 50? Should they start them at 40? Should they get them every year? Should they get them every other year? And so that's why it's so important to have a primary care doctor who knows you, who knows your history, and together you guys can come up with a plan that you both feel comfortable with that also screens and keeps you as safe as we possibly can. We still strongly support starting at 40, but certainly American Cancer Society says, well, maybe you can wait till 45, and other organizations say, well, maybe you can wait till 50. But we have people like Tammi that we deal with every day, so we have a certain perspective because we see young women who come in. But again, the primary care doctor and that conversation with them and putting together a plan that's right for you is really important.
That's such great advice. And as we've done these videos throughout the months, we keep coming back to how critical primary care physicians are in your medical journey. And Tammi, I know you alluded to it earlier, and moms, we often just put ourselves to the side. I mean, you had a full house of 6 kids, and I only have 2, which seems ridiculous, but we get them taken care of. We make sure they're schooled, and we often just kind of ignore the little things there. And how are you now? Tell us about your health these days.
Well, I am very thankful because it was caught so early. I, for the first 5 years, was followed very closely, and now I just come in to see Dr. Richardson once every year. And it's kind of, once my ovaries were out, everything was pretty much done that needed to be done. I do still have to follow up with genetic counseling. My last round of genetic screening found a variant of unknown significance. And so I do have to follow up with that. They recommended in 2 more years to be screened again to see if they can kind of sort that. Is it likely to be, that's tied to malignancy, or is it likely that that's likely benign? And just making sure that my daughters know that their primary care providers do have to be aware that they have this family history because of, my diagnosis. So that's really, I've been really blessed to be able to kind of just move on with my life from that. Whereas a lot of people I know have years that they, just have to spend where it's almost a full-time job just struggling for their health.
Yeah. Well, what a gift that you can be able to share your story and your journey. So your daughters know what, potentially, hopefully not, but what they might be up against. But knowledge is power for our healthcare. Dr. Silva, what else would you like to share with our audience as it relates to awareness for breast cancer, and what, especially moms, like what are there warning signs that we need to be aware of? What would be your parting words?
That's great advice. So thank you. So first off, be body self-aware. So get to know what your body looks like, what your body feels like. When you look in the mirror, if one day something seems a little off when you're looking at your breast, is there a little dimple that didn't used to be there before, or just a change in the size of the shape, a change in the nipple, any discharge from the nipple that's new? So just be really body self-aware. We've moved a little bit away from saying, oh, every month on this date, you have to do a breast exam. For many people, that was very frightening. They felt like, hey, I don't know what I'm feeling. And so they either just didn't want to do it, or they felt like, well, what if I miss it? Then it'll be my fault. So we really, that is not the message we want to convey. But what we want to convey is be body self-aware. And if you notice a change, as Tammi did, go see a physician, primarily your primary care doctor, and then get the ball rolling from there. So that's the first part. If you are at average risk, meaning there's no one else in your family who's had breast cancer or other suspicious cancers, then you're expected to start mammograms when you're around the age of 40, again, in conjunction with your primary care doctor. And we would say be consistent with getting your mammograms, every year, as long as you're in good health. So that could, for some of my patients, I have women, in their 80s that are still going and hiking, in Big Bend. So those women are still getting mammograms. But if someone else has a lot of health problems and they're not as active and not getting out and about, then that might be the time that you could probably reasonably stop getting mammograms. But it should be a lifelong thing that you remember to do every month. And some people, not every year, some people tie it to their birthday, some people tie it to October, but there should be something that jogs your memory every year that it's time to get your mammogram.
That is such great advice. And it's funny, last year I turned 40. And so talked to my primary care. I went and got my first mammogram, happened to be October. So when we scheduled this video, I was like, oh, okay, I did that a year ago. It's time to go and do it again, because as your advice said, I talked to my primary care. I'm in normal health, I would consider, but very dense breast tissue. So they recommended every year for me. So this is a good reminder for me too. And for all y'all watching, maybe it's a reminder, but tag it to a special date and then go celebrate after, right? I think, Dr. Silva, I know people are sometimes a little nervous about mammograms and the process. You just don't know what to expect. Does it hurt? What do you tell your patients about that?
So, there is pressure that they put on the breast. If you've had one, you've experienced it for yourself, but it's definitely not what I would consider severe pain. And the techs who are mammography techs are generally amazing, and they can position your breast in ways that you never quite imagined would happen. And it really is not painful. And even when you are in the compression, it's lasts less than a minute. It's 30 seconds or something like that. So it's over very quickly. What scares people is when they get called back. Like they say, hey, come back. We want to take another picture, or maybe you need an ultrasound. Even that, I know that's terrifying, but you need to remember that the vast, vast majority of women who get called back, we're able to end up saying, no, now that we look at taking the second look, this is fine. You're fine. So if you get that ominous call to come back, don't make it scare you so much that you run in the opposite direction, because even then it's highly, highly likely it's going to be fine.
I love that, because we don't want to hear that bad news, and we just kind of want to put that behind us and not think about it. So yes, but make sure you do the follow-up. And I can attest, it's not bad, ladies. It really isn't. And yes, they can make different shapes that you never thought possible. So great advice there. Tammi, we're so thankful you are healthy and happy now, and safe with your six, not babies anymore, 19 to 12. What would you tell a woman who is watching this video right now? Maybe they haven't had a mammogram. Maybe they are starting their breast cancer journey. Maybe they are in it. What advice would you give them?
just to be kind to yourself and not to feel guilty about having to prioritize your own health. I think a lot of times moms feel like their identity as a mom is, tied to putting everyone else first, but you can't take care of your family if you don't take care of yourself. So that was the biggest lesson I learned from this, is you have to take care of yourself, and also to not neglect things and just always put it off for the future. After 2 months after I had my mastectomy, my husband and I went away for the weekend together, and it was the first time we had been without the kids overnight in, I want to say 12 years. Oh. And yeah, and we thought, we've been neglecting this relationship too. We've been, we're very in love, we're co-parenting our kids and everything, but we have to take that time away, me for myself, us for each other. And so that was a really good, but just also to find a healthcare team that you can trust and that, does work together. And especially with UTMB, I feel like because it's a teaching hospital, they're always up to date on the latest research. And that was such a help to me too, as I made these decisions that maybe other practices maybe wouldn't have been okay with removing just my fallopian tubes. They would have said, no, you need to do everything now. But because UTMB is always up to date with everything, it was just a really good experience. I mean, as much as it can be.
Well, when you're going through this, definitely having a care team of providers that you can trust. And I love how open they were to you showing them information, and because we need to make informed decisions. It's our body still, and we know it best. And I think y'all would both agree with that. I'm so thankful for both of you joining me today. If you are watching, in the link below, I am going to drop the breast cancer services that they have at UTMB. So if you are in need, please reach out to them. If you don't have a primary care physician, I'm also going to drop that link, because again, as we continue to reiterate, you need to have a strong relationship with your primary care physician. And ladies, you need to be going to your primary care, and not always just when an issue pops up, but something, preventative, so that way they know you, and they know that something isn't right with your body. So make sure you're doing that too. But as always, I thank UTMB Health for the expert opinions and advice that they continue to put out to our Houston moms audience. We are thankful for them being our preferred provider for the Southeast Texas area. Tammi, again, so glad you were doing well. And Dr. Silva, it was a pleasure. And until next time, we'll see you guys. Bye-bye.
Thank you. Thank you.